Hi to all of our Facebook viewers. I'm here with Marko Vujicic, the Chief Economist for the American Dental Association, and we're here for the first inaugural Schein Chats episode, and we're here at the ADA convention here in Denver. I'm not sure exactly what the number is, the 70th annual or something. I'm not sure exactly what the number is.
I'm not either.
I'm not either.
It's
okay.
up there.
Okay.
Yeah.
But it's really a great pleasure to be with Marko. Marko is someone I've had an opportunity to be with over the years and listen to Marko talk about where the industry is and where the industry is going and how the profession is affected and how people think about things. And Marko and I share a bit of a common background, enthusiasm. As a boy in Canada, Marko had a hero. He had a hero in Wayne Gretzky. And Wayne Gretzky was a very successful hockey player, maybe the most successful hockey player that there was. And one of the things that Wayne always said was, he said that, I don't chase the puck. I don't chase the puck. I don't go after where it is today. I look to anticipate where the puck is going to be. And then I look to go to where the puck is going to be. So that's a lesson for us all, I think, in many aspects of our life, in many aspects of business and the profession. And so when you think about the profession, you think about the industry, and we're almost coming up on the end now of 2016, going to 2017. Can you reflect with us a little bit about maybe where you see that puck going, and some of the things that are important to keep in mind, and maybe if you could stretch a little bit beyond 2017 too, because some of these things are pretty significant shifts in healthcare overall, certainly oral health, but healthcare overall.
Yeah, so first, thanks for having me, Jim, and hello to everybody watching. So a lot of my time in my role as the Chief Economist at the ADA is spent exactly on thinking about where that puck is going. And I would say if there's one big message in terms of the future, not just next year, but the next 5-year horizon, let's say, it's that healthcare in the US is changing dramatically. And I've called it a once-in-a-century moment, but because of things like the Affordable Care Act and wave of consumerism and various forces, we're seeing radically changing dynamics in the healthcare sector, dentistry included. And I actually think it's throwing up a whole bunch of new opportunities for the dental profession.
You know, when people feel change and people feel a shift, the first thing many people feel is a sense of nervousness and even a sense of dread. And it was very good to hear you talk about opportunities, because sometimes it's hard to actually feel and see what might be possible. So when you think about it in a little bit more detail about the dental profession itself, and also how the industry fits in collaboration with the profession, and how the industry also could possibly help accelerate change in a very positive way, what comes to mind?
Yeah, so I think this is the most exciting time to be a dentist in a long time. And let me just give a couple of reasons why I say that. So one new opportunity opening up, as you said, Jim, is collaboration across different types of healthcare providers. So the real change happening in healthcare now is that there's much more focus on health outcomes, on patient satisfaction, and really trying to construct kind of multidisciplinary healthcare services to drive those outcomes. And a really nice thing for the dental profession is in the last, let's say around 5 years, we're seeing a lot of really good research showing that if your oral health is improved, you actually have medical outcomes that are improved and healthcare costs go down. So I think dentists are going to have new ways of contributing to whole body health and to have new opportunities they just haven't had before because of the way kind of the currents are moving. And just the flip side of that as well is there are about 9% of Americans that visit a dentist every year, but don't visit any other type of healthcare provider. And I think there'll be more and more opportunities there as well for dentists to do things like health screenings to help kind of maybe detect undetected chronic conditions and hopefully be reimbursed for it.
So let me ask you a question about that. So it's interesting because I've heard that before about the fact that many people see their dentist more frequently than they may see a primary care physician. So you could say this is a gateway, right? The dentist is a gateway to total health. How ready do you think and how aware are the average dentists to this opportunity? And when you think about how can we help and how can we support people starting to take action down this road to positively, create this change toward focusing on outcomes in the health system?
So again, you talked about change, and I mean, Gretzky scored 92 goals because he did what others didn't. Right?
Yeah.
I mean, he moved in riskier areas and in white space on the ice, right?
Yeah.
So again, the change process it's not always comfortable. There's a leading edge of innovators, but certainly I think for folks like you, Henry Schein, and certainly in the American Dental Association, a big part of our role is to help dentists navigate that change, and to help make sure that kind of the rules that are being set in this new environment are good for patients and dental care providers, right? So one thing kind of the ADA has worked on is to put together, well, what are some models where dentists can participate in this type of multidisciplinary care, right? So one, on the public side in federally qualified health centers, for example, there's a huge opportunity there, right? There are many examples of pediatric dentists, for example, connecting with pediatrician practices in their town or even with larger organizations to actually get the medical side, the pediatricians, making sure that children are getting regular dental care after age 1, and vice versa. If a dentist notices chronic condition or something that is suspicious, can refer to the medical side, right? So again, we're working hard as an organization to try to make sure that dentists are educated about these opportunities, that the rules being set out there are provider and patient friendly. And I'm sure organizations like Schein also have a huge role to play there.
Well, one of the things that we're very interested in is to make sure that through communication, conversations like this and other conversations, we continue to foster the development of trust that we're in this together, right? We love serving the dental profession. Our goal is to help facilitate the best success possible for dental professionals. And when we think about going forward in the future, we also think about not only this communication, but the communication turning into greater detailed collaboration.
Right.
But then when we commit ourselves to that collaboration, then we need to create forums where people can really be creative and try new things. Because when you're in a situation like this, sometimes the things that you'll look to take on don't necessarily always work, but we can't be afraid to take steps forward. Because one of the other things I think I remember you saying, Gretzky had a couple of quotes. One of the other quotes related to, I never scored a goal on a shot I didn't take, or something like that, right? So you've got to be in the game, and so we as Henry Schein and we as industry, we actually really want to deeply be in the game. And over time, if you guys think that there are things that maybe we're not doing enough of and things that we can do more of, we want to make sure we're the best partner that we can possibly be in that process. Because clearly going forward, don't know how far down the road, there's going to be more and more evidence that demonstrates that people who have good oral health overall have a lower lifetime cost to their total health care. And that's a big deal.
And that's a value proposition I think dentists have known, but for key stakeholders, both in government officials and industry and medical care providers, we haven't had really solid kind of evidence until now. So I think there's a confluence of a lot of circumstances, right? So again, the area I lead, the Health Policy Institute, you know, we're in charge of compiling kind of the best credible data and evidence. And so, you know, I'm comfortable saying that there is some pretty strong evidence now on those links. The other thing is we just released a new set of data showing how oral health affects people's lives. So you focus, Jim, on the impact on medical care costs. Right. But we found out that, you know, 1 out of 3 low-income adults in the U.S. say the condition of their mouth and teeth affects their ability to interview for a job. And so there's a whole set of new, call them hooks or value propositions that I think that the profession is poised to leverage. And just one thing on timing, I think it's important for dentists and others listening to kind of to know that this is a long game. The stuff we're talking about today, this is not overnight change. This is transformational. This is a 20-year horizon, right? So again, it's not something that I feel is, you know, knocking on everyone's door, so to speak, now. But for organizations, I think, I don't want to speak for Schein, but you need a long-term view. The ADA certainly needs a long-term view. You know, millennial dentists are, you know, they're different in many ways than you know, dentists that are older today. So I think, you know, you made a great point that, you know, you can't shy away from this change. It won't go away. As an economist, I'm comfortable saying that. But the point is, you know, we pride ourselves in really looking at data dispassionately and trying to get the evidence in front of dentists and other stakeholders that I'm convinced there's so many exciting opportunities.
So you're definitely reinforcing for me also that this is an extremely exciting time for the dental profession and the dental industry. But there's something else before we run out of time I wanted to touch on, if it's okay. Something else that you mentioned, when we just look at the reality of what's happening with patient traffic, there are some things that we see that are pretty clear and not necessarily sure what's actionable to do about it, right? So we see coming into the system that there's more children that are receiving care, and some, you know, low-income children to the Affordable Care Act, and then we also see that the elderly are also on the trend up. But we see that the working age adults, 19 to about my age, Stanley, I'm not retiring exactly yet, but we see that they're not going to the dentist, for whatever reasons, whether they feel they don't need to go to the dentist or there's some certain economic pressures. But that is a big cohort that actually has dental need and dental opportunity. And how do we create that? How do we get them back? How do we get them back in? Do you guys have some thoughts on that?
So that's been a big, certainly in my group, again in the Health Policy Institute, we've studied this a lot. So just as you said, Jim, the 2 main reasons are cost, which is a big bucket. It's too expensive, I can't afford it, stuff like that. And then I don't have a need, right? So again, in my view, we have an opportunity to play on both of those kind of reasons. And you know, certainly in the ADA, we are, number one, digging deeper into the motivations behind dental care visits, especially among the younger adults. And then slowly starting to think about ways, how might we design some interventions to reverse kind of this downward trend among adults. Because as you say, I think the key thing you mentioned was there are needs there. Right?
There's needs.
And especially when you look at
there's opportunity.
And there's
again,
opportunities,
with the preventative health.
And when you look at different populations as well, like pregnant women and diabetics, you know, we know that there's certainly, you know, a lot of unmet dental care needs among those groups.
I actually think that industry, and Henry Schein in particular, can really help in this as well by helping our customers, who are healthcare professionals, focus on patient care and allow us to help and focus on practice care. And part of focusing on practice care is helping them understand through marketing programs and different kind of tools that maybe we can help them incorporate that make it easy for patients online to book appointments and do things like that through our practice management technology, practice management systems. So I think there are a lot of things that industry, along with the profession, can do to bring that cohort of working adults back in, because that will make a huge difference and give a lot of people a lot more breathing space.
Yeah, and I want to follow on, because basically you're talking about consumerism.
Consumerism,
right?
right.
And this is another huge development, this increased wave of healthcare consumerism. And let's talk specifically about young adults, millennials, right? Those, whatever you want to call it, under 35. Right? So we know that the majority of Americans under 35 will look online at cost and quality information before they even think about contacting a provider to book an appointment. And it's not even calling anymore, right? I mean, it's booking online and booking through text, right?
Yeah,
so that's a very different patient mindset than somebody, maybe older Americans today, that have built relationships and kind of interact differently. So I think there's a huge opportunity there for different folks, and I'm sure Schein is exploring this. You know, how do you make it very easy for patients to contact their dentist, to book appointments online, to look at where they are in their care treatment plan, to look at if they have dental coverage, where they are in terms of using up their benefits. I think there's a huge opportunity there.
I think that one of the things that's happening, again, throughout the entire industry, and if you look around, there's a lot of even startup organizations that are looking to create tools to create patient demand, make things easier, you know, tie into the next generation patients that are looking for exactly what you said. So for us, when we look forward, pulling it all together in a collaborative way, again, in partnership, in collaboration and communication with you and your colleagues, is something that we're highly interested in. What we're also highly interested in, because I think we're running out of time, is inviting you back again for another Schein Chats at some time. But I think we're running out of time right now, so I really would like to thank you on behalf of all Team Schein for joining us. Marko, you're really a terrific resource for all of us. And
we're happy to do that,
appreciate
and
it.
you got a deal.
Yeah.
So
and
good.
This is Jim Breslawski signing off. We will see you next time on Schein Chats.
Skate to where the puck's going.
There you go.